just 22 million residents, it may surprise you that the land down under is the third largest medical device market in the Asia-Pacific region. Only Japan and China spend more on healthcare. Interested in getting your share of the Australian market? We'll tell you how. First, let's take a look at how Australia regulates medical devices. In Australia, all medical devices are regulated by the Therapeutic Goods Administration, known simply as the TGA. This agency reviews all device applications, enforces quality system requirements, and monitors the safety record of medical devices sold in Australia. By now, you probably know that most countries group medical devices according to the risk they pose to patients and users. This classification scheme determines the regulatory pathway. Australia applies similar classification rules as used in Europe. There are 2 categories of Class 1 devices, 2 Class 2 categories, and finally Class 3 devices. In most cases, if your device has CE marking in Europe, the classification will be the same in Australia. Before you begin the registration process, you'll need to appoint a sponsor in Australia. The sponsor coordinates your device submission and acts as the regulatory liaison between you and the TGA. You have 2 options in appointing a sponsor, assuming you have no office in Australia. You can appoint a distributor, or you can hire an independent third-party company. This is an important decision because the sponsor's name will appear on your device labeling and registration documents. Make sure you are comfortable working with them over the long term. Here's another important step in the process. The TGA requires most manufacturers to demonstrate compliance with Australian quality management system requirements. Most companies achieve compliance the same way they do in Europe, by implementing the International Quality System Standard for Medical Device Companies, ISO 13485. ISO 13485 certification is not required by law, but it is the best way to demonstrate compliance with Australia's essential principles. Again, if you manufacture a Class 1 device with a sterile or measuring function, or any Class 2A, 2B, and 3 device, you probably already have ISO 13485 in place. If your device requires testing and has been tested to an international standard in another market, those testing reports will be accepted as part of your submission to the TGA. Clinical data from other markets are often accepted as well. Most companies entering the Australian market have CE marking already. If you do, there's no need to prepare a separate technical file or dossier. You can submit your European version instead. Your sponsor will submit this documentation along with your CE marking certificate and other information to the TGA for review. If the TGA approves your application, they'll issue an ARTG listing number, and the status of your approval in Australia will be posted on the TGA website. Your registration does not expire as long as you don't make substantive changes to the product, claims, or its intended use. You will need to pay a device listing fee each year to the TGA. So how long does it take to get approval from the TGA? It varies widely, but we have a detailed chart available on our website that provides information for all classes of devices sold in Australia. We hope this presentation has given you a basic understanding of the Australian regulatory process for medical devices. Want to learn more? We have flowcharts, articles, regulations, and other resources